In this video, I'll describe what's called Darwish hysteroscopic patency test as a concomitant hysteroscopic tubal bubble flow test and peristalsis test. It's well known that the tubal ostia seen via hysteroscopy are used to inform us about the panoramic view of the uterus, and unfortunately no description of what's behind the tubal ostia via hysteroscopy. In a recent publication, we demonstrated what's called Darwish Hysteroscopic Triad as a missed anatomic landmark, which is formed of the most proximal conical fine white circle, which is ostium, representing the end of the endometrial cavity, as a base of a cone, which is followed by a shallow conical groove, which is the first millimeters of the intramural part of the fallopian tube, and finally a distal pinhole dark spot, which is the narrowest part of the fallopian tube, representing the tip of the cone. Here you can see the arrows demonstrating the ostium as a wide fine ring, outer ring, and a dark pinhole, dark spot inside this cone, representing the tip of the cone, and the walls are formed of the intramural part of the fallopian tube. These videos are taken from infertility patients when evaluating the endometrial cavity during hysteroscopy. As a proof for the intramural part of the fallopian tube to be the walls of the cone, in this picture you can see the major folds of the endosalpinx, in this case representing that, confirming that the diagnosis of the intramural part of the fallopian tube is what's seen as a wall, side walls of the cone of the Darwish triad. Here you can see a polyp coming from the pinhole dark spot of the Darwish triad, and this polyp is not endometrial cavity polyp. It's coming from the triad and actually protruding inside the endometrial cavity, and it needs fine and delicate instrumentation to excise this polyp. The standard hysteroscopic scissors or resectoscope are not recommended for such a case. And here you can see fine polypi inside the intramural part of the Darwish triad, and these polypi may represent a cause of infertility because they make a valve-like occlusion of the ostium and the isthmic part of the fallopian tube. If we wait some time during hysteroscopy and see the bubbles of the air coming inside the endometrial cavity, they can be seen going through the Darwish triad, and this is called positive bubble flow test. And these bubbles are going inside the fallopian tube via the endometrial cavity as seen in these videos. If air bubbles are not seen, you can inject few cc's of air in the side channel of the office hysteroscopy channel sheath to see these bubbles. Actually, positive bubble flow test is an anatomic patency test, which means that the isthmic part or the proximal part of the fallopian tube is anatomically patent, but it may not be functionally working as usual, because the fallopian tube is not just a simple tube, it is a paired dynamic organ. In this case, you can see the air bubble trying to go inside the Darwish triad, but due to the presence of a polyp inside this triad, the air bubbles cannot cross the triad to go inside the fallopian tube. And this is called negative bubble flow test. And the cause of negativity is clear here due to this polyp. The negative bubble test may be due to adhesions, may be due to fibrosis, due to adenomyosis or subserous myoma. Interestingly, this case shows fine adhesions inside the intramural part of the Darwish triad, and these fine adhesions prevent the bubbles to go through the fallopian tube. These fine adhesions can be cut by the scissors. In this case, you can see the tubal ostium and intramural part are moving, contracting and retracting, or with contractions and relaxation, and this is called peristalsis of the proximal part of the fallopian tube. So this is positive peristalsis test of the distal part of the proximal part of the fallopian tube. In this case, the positive peristalsis is present, contractions and relaxation of the ostium and intramural part, and there is a polyp inside the Darwish triad, and with contractions and relaxations, the polyp will come outside the triad inside the endometrial cavity with frequent contractions of the proximal part of the fallopian tube. Here the polyp is coming outside and protruded inside the endometrial cavity, which is a document that this case has a positive peristalsis, which pushed this polyp to be inside the endometrial cavity. Many cases, if you look to the Darwish triad, you will see the contractions and relaxations of the ostium during examination to see positive peristalsis tests. So if we combine positive peristalsis, which is a test of physiology of the proximal part of the fallopian tube, and positive bubble flow test, which is a test of the anatomy of the proximal part of the fallopian tube, this is called Darwish hysteroscopic patency test, which means that the proximal part is anatomically good and physiologically good. So the proximal part has a good function to make ascent of the sperms to fertilize the oocyte in the ampulla. This work has been recently published in one of the international journals, and you can find it via the PubMed or other sites to see the details of hysteroscopic Darwishscope test in cases of normal fallopian tubes as well as hydrosalpingeal fallopian tubes. In conclusion, I would say that hysteroscopic bubble flow test alone is an initial assuring test of anatomic tubal patency, but adding tubal peristalsis to bubble flow test, constructing what's called hysteroscopic Darwishscope test is more accurate and informative about anatomic as well as physiologic patency. By this way, we can study tubal function or the proximal part via hysteroscopy.